Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, CMS's newsroom, Biden-Harris admin announces new initiative. ACO Primary Care Flex Model aims to improve access to high-quality primary care for underserved Medicare populations. The U.S. Department of Health and Human Services, through CMS, announced a new voluntary model empowering primary care providers in eligible ACOs to treat those with Medicare using innovative, team-based, and person-centered proactive care. It's the latest example of CMS's Innovation Center's investment in strengthening the primary care system. The Innovation Center, established by the Affordable Care Act, was used to identify ways to improve healthcare quality, health outcomes, and reduce costs in Medicare and Medicaid. People whose PCP participates in the ACO PC Flex model may get care in more convenient ways, like virtual means, extra help managing chronic diseases, and more preventative health services. It's designed to incorporate health equity and address health disparities in primary care, especially for underserved populations. It also enhances funding and incentives for team-based care approaches to medical and social needs, which creates total cost of care savings while preserving and enhancing quality of care. CMS's Innovation Center will test the new model within the Medicare Shared Savings Program. ACO PC Flex Model is a 5-year voluntary model beginning on January 1st, 2025. CMS is planning to select approximately 130 ACOs to participate, and organizations interested must apply to shared savings. Applications open on May 20th, 2024 and are open until June 17th, 2024. ACO PC Flex Model requests for applications planned release is the second quarter of 2024. Facts about Primary Care Flex Model can be found at the link below. The fact sheet as well. Next, the push for permanent telehealth funding kicks into high gear in Congress. With ongoing federal Medicare reimbursements for telehealth set to expire at the end of the year, there's a bipartisan push underway to make payments permanent. Members introduced the Telehealth Modernization Act of 2024 on Tuesday, and would also expand access to more qualified health clinics. The bill ensures access to tech for providers across the country, with particular impact in underserved rural areas where decades of hospital closures only exacerbated challenges of delivering healthcare. Permanently extending telehealth flexibilities for Medicare patients makes care more accessible, regardless of the physical location. AHCA is a vocal supporter of expanded telehealth usage and stands in support of the bill, as well as leading age. Both officially recommend it and promise to keep providers updated on the progress. The Telehealth Modernization Improvement Act is a crucial step towards modernizing a fractured healthcare system to be more efficient, accessible, and patient-centered. Although use of telehealth in nursing homes dropped significantly from the height of the COVID-19 pandemic, by the end of 2023, it was still used in greater than 60% of facilities. Lawmakers plan to expand whistleblower retaliation protection for nursing home residents. Nursing home residents would acquire new legal protection against retaliation from the facilities after making complaints about the facility under a bill now on the Illinois Senate floor. Measure amends existing Nursing Home Care Act by expanding the definition of what counts as retaliation to cover actions taken against both staff and resident whistleblowers. Residents in nursing homes should not worry about retaliation for wanting better living conditions. The bill will create a broad list of protected behaviors for residents, such as disclosing or threatening to disclose info about the facility, testifying before a public body, trying to move themselves or others to a new facility, and becoming a member of the resident council or union. Workers and residents both consistently reported fearing retaliation of whistleblowing for years, as far back as the late 60s, according to a 2023 report published in the Journal of Applied Gerontology. The asymmetry of power between residents and staff was important to address, but real complaints of retaliation or fear of retaliation should not be construed to demonize the entire LTC sector. If nursing homes can demonstrate it would have taken a perceived retaliatory action regardless of protected behavior from residents, it will not be in violation of the law per existing provisions of the Act. Change Healthcare starts to return platform services following cyberattack. As promised, Change Healthcare on Friday entered a new stage of recovery from a major cyberattack that has been massively disruptive to the healthcare industry. Change Healthcare's pharmacy network is now online and promised further systems recovery next week. The full extent of the cyberattack's impact on nonprofits is not clear, though more details about holes in cash flow and the need for interim funding assistance is emerging. Interim funding options offered by Optum to address payment backlogs are not working for many providers. Long-term effects from the backlog could include inaccurate QMs for value-based care assessments, which in turn could affect claims-based calculations from CMS. Federal agencies and Congress started assessing security failures leading to the cyberattack and how to prevent it from happening again. Senators have pushed Health and Human Services to hold United Healthcare accountable. Leading Age announced it will be holding a town hall Thursday to help give providers info and insight. There must be lessons learned from the incident by healthcare companies, consumers, and government, as the breach highlights the need for robust security measures in healthcare and better government oversight to safeguard systems. Regulatory bodies need to hold healthcare entities accountable for lapses in data protection and ensure swift responses from the government, law enforcement, and stakeholders essential to bolstering healthcare sectors against future attacks. And finally, nursing homes turn away people recovering from opioid addiction. SNFs in Rhode Island got the attention of the Americans with Disabilities Act advocates when they refused to admit people coming out of hospitals after treatment for opioid addiction, according to a study published in February. The study sounded the alarm on the trend. Researchers surveyed 27 nursing homes between 2021 and 2022. Surveys ended after the U.S. Department of Justice made a statement on opioid use treatment and the Americans with Disabilities Act. The study took place before affirmations of anti-discrimination protections became more widely publicized across the country, which may have allowed administrators to voice views they would have been more cautious in openly expressing today. One facility said that it didn't admit 110 people referred to them based on psychiatric issues, drug use, smoking, or opioid treatment, but not all reported the refusals. Some said they refused patients if they knew they were on medications such as methadone or Suboxone because most nursing homes don't have clinicians to prescribe the drug. Many facilities don't have staff to transport to methadone clinics, and with financial strains, didn't have training in place to help people in recovery. About 30% of patients discharged from hospitals for opioid use disorder are readmitted within 30 days, and about 16% go to nursing homes. Nursing homes usually house older adults, not younger folks with drug use disorders. Some surveyed were concerned about the potential for violence if they admitted someone in recovery. Also, age differences can make socializing among residents an obstacle, impacting an individual's mental health. News comes as the survey released last month included 772 U.S. adults that showed 38% over the age of 55 talked to healthcare providers about substance abuse. Thank you for joining me on News This Week in Nursing Homes. To get more Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.